you get to the age where maybe, they transition, it starts to mess with your mind. One thing that kind of got me out of not wanting to go to the doctor was the fact that, I have to take care of my daughter. I have sole custody of my daughter and I'm a single father. If something happens to me, she has nobody. So I have to stay at tip top optimal performance. Uh, I'm 52. I've never had that one test that we all avoid. The last couple times I went to get my annual physical, my primary care physician was ask questions about any issues. All my, test results come back. So he hasn't really pushed me, and it doesn't run in my family having issues. But this year, I can't just keep basically, rolling the dice thinking I'm okay. I need to go ahead and find out for sure. And if there is a problem, like you said, get out ahead and get in front of it. So, while I would tell everybody, that's what we need to do. I don't always do it myself. I'm trying to be better. But I think it has a lot to do with pride and fear. Fear of the unknown.
Okay, I understand that. I'm gonna go over to you, um, and say, what are your outlook on your health? How are you taking care of yourself? And what are things you're doing to make a better? Because I know earlier in the year we talked about one goal you set for yourself, and I'll let you speak on that if you want to. But what are you doing as far as your health?
Now, John, did you swing that back to LV or did you go to
I'm
JP?
sorry, I said Coleman. I'm staring at Coleman and I say
Oh,
LV.
Hey,
See, I must still be.
I
okay.
thought he wanted some kind of way because it was almost the same question. I'm like, dang, man, I just opened my beer, I was
Yeah, we can question if John be drinking or not. So,
Hey, I
so
earlier I had some brain
what's in that
fog.
tea? What's in that tea?
yeah, nah, but my goal was to get back out here and start walking and get back on top of my health. Um, it's interesting because I think to a certain degree we raised not to go to the doctor. I remember in high school I broke my hand, I mean a clean break, my bones sticking up, and I go up there and tell my stepmother. She told me I'd be all right. I went to school the next day. And it wasn't until the nurse at school saw it and she screamed and called my parents, and my parents was like, "Yo, he'll finish out the day. We'll get him after school." So I didn't come from a legacy of going to the doctor in the hospital. We went when something was known to be, wrong. That changed for me. I think it was 2018. I had cellulitis, man. I was supposed to be catching a flight to California, and I was limping. And my wife was like, "Yo, you can't get on a plane like that." We ended up calling telehealth, and they ran some tests on me. They was like, "All right, Mr. Coleman, you don't." I thought I had the flu. They said you don't have the flu, but to the doctor. I was like, "All right, I'll get up and go in the morning." This was like 2 in the morning. I said, "I'll get up and go in the morning." They told me, they said, "No, either you go to the emergency room right now, or we're going to call the ambulance." I go to the emergency room, and they said they're going to check me in. I was like, "All right, well, can y'all give me a room number because I need to tell my sisters." And they said, "Yeah, your room number is ICU." And I was like, "Hold the hell up. Y'all said check me in. Y'all didn't say ICU." So next thing I know, I'm in ICU. My kidney functions were shutting down. They had to put a temporary stent in my neck for dialysis, and it got real fast. Now it was cellulitis, and they don't know exactly how I got it. But if it hadn't been for my wife, I'd have got on that plane, limping and everything. And they said if I had gotten on that plane, I probably wouldn't have made it. Um, as a man, I always looked at my father as invincible, somebody who could never be impacted by illness and things of that nature. And I always tried to carry that for myself. And I quickly found out that invincibility is a falsehood. It doesn't exist. It's just a word that we throw out there, and it's in comic books and things of that nature, but it does not apply to us as human beings, and it does not apply to us as Black men. So from that standpoint, I started going to the doctor, and I take my health a lot more seriously. Because I remember, um, man, my brother walking in the room, looked in my brother's face, and that's when I knew I was sick because I saw it in his face, you know.
Mm-hmm.
And then, man, they tried to stick a urethra in, got me bleeding. I mean, it was a whole lot that went along with that experience that let me see. Now my sons can't even cough, and I'd be like, dog, we need to go to the doctor because it's a real issue. And if you let it get too late, you could put yourself in a position where medicine cannot do anything for you. And as much as we pray and as much as we have our spiritual lives, I'm a true believer that God created doctors and
Right.
he advances medicine for a reason. And now I am trying to be spiritually, mentally, physically healthy, um, in every aspect that I can. So I no longer take it for granted. And I try to put, health at the forefront, not only for my kids and my wife and my sisters, but also for myself and making sure that I'm taking care of myself because we can't be an example to anyone at the graveside. So that's my testimony, John.
Thank you. That's a very good testimony. And one thing you talked about how something happened to you at the airport. One of my coworkers last week, her boyfriend was at the airport, and he was acting very erratic. And the police called her and they're like, "We're about to arrest him." And let's he calm down because he must have had too much to drink. Well, come to find out, he was going through the symptoms of a stroke, and he had been going through the symptoms of a stroke for 9 hours. And she's like, "No, that's not how he is. Not him." They got him to the hospital because he had a stroke and he's paralyzed on the left side. And see, some of this goes to the point of making some of the poor choices we make as far as getting health care, but there's also the factor when people misdiagnose you because they think you're acting erratic, you're doing this, but not knowing that's out of character. And I'm gonna let Gerald talk, JP talk a little bit about the understanding of some of the mental aspect. We're not gonna go too deep into mental health, but I want to tackle the point of why through therapy people have told him why they're apprehensive with getting medical checkout, or what are their reasonings for not getting the proper care that they need.
Yeah. Well, there's a couple of reasons. One is struggling to accept the aging process. When you think about it, think back to when we were in our 20s, in our teens and 20s, and think about how that invincibility that Coleman was just talking about, that applies to youth. You know, when you are young, you are not thinking about prostate exams and this exam and getting your blood pressure checked and getting checked for diabetes and this and that and this and that. And so as we age, a lot of times people notice some of the subtle changes that go along with age, an ache here and a pain there. And, I remember I pulled my back getting out of the bed one morning and was trying to figure out how the hell did that happen. Like I just was getting out of the bed. And so a lot of times it can take a while for people to adjust that, hey, I'm getting older and I'm starting to notice some changes. And it's hard to accept it because psychologically, people are under the notion that if you acknowledge that your body is changing with age, that is somehow a weakness. You are no longer able to do the things that you were able to do when you were younger. And as men, as Black men, we struggle with appearing to be weak in any way. Because when you are a Black man living in America, you do not have the option of being weak. You will get squashed like a bug. And so what we have to do is realize that we do not, it's not that we are giving up our strength in acknowledging the changes in our body. And so when I am addressing this issue with people in therapy, I approach it from the perspective of you getting the checkups that you need. And if you are prescribed medication and you take it, that is you maintaining functionality, maintaining your strength, as opposed to not going to the doctor. That's when you're sacrificing that strength. And so I agree with what Coleman was talking about, you know, the whole invincibility of the Black man. And we have to try to move beyond that. Another thing that plays a role in it is I don't think that we as a people have ever truly adjusted, and this goes all the way back to slavery, have ever truly adjusted to having access to health care. You know, because historically, Black folks didn't have equal access to health care. And it has become multi-generational that we have kind of held on to the notion that, well, we don't go to doctors. We just deal with it and we're going to be all right. Well, no, we're not going to be all right. When it's time to go, it's time to go. And so, you know, Coleman, when I hear you saying that if your kids cough, like you are taking them, and the co-host of my radio show teases me because when we walk into urgent care, them people are like, oh, hey, Sasha. They know my baby because I do not know how to fix medical illnesses. If it's something wrong with her, we go into urgent care, and yes, they know her up in there. And sometimes they look at me crazy like, why'd you bring her here? Because I heard something. Can you bring her back and you hear it again? Because we don't hear it. Okay. But yeah, those are my thoughts.
Hey, can I throw one other piece out there, John?
Go ahead.
The other piece of it is the shit is uncomfortable. So like Laverio talking about going to get the test, right?
Right.
Man, they hit me with that finger, dog. They hit me with the finger, John. I had to go sit out in the damn car, man. I was in Maryland, bro. And they hit me with the finger, right? So I mean, I go out to the car and I call my wife and she's like, you all right? And I was like, yeah, I just need you to talk to me for a little while. She was like, why? I said, the doctor hit me with the finger and I'm thinking about going back in there and whoop his ass. Because that was assault. He didn't say, here it come. He didn't say it's about to be on, Mr. Coleman. He just hit me with the finger. I told y'all last week I thought it was two fingers, dog. Until y'all convinced me he just must have had a big burly knuckle because he hit me with the finger and it was uncomfortable, John. I didn't like it.
The fact
so every time they talk about that, listen, man. Listen, he took my virginity, dog. He hit me with the finger. He didn't say nothing. He didn't, I mean, you know what I'm saying? He didn't rub the back of my head or nothing. He just hit me with the finger all of a sudden. Bam. Next thing I know, I was like, oh my goodness. This has been an experience. Before
buy you dinner first or nothing. Like it just
nothing.
happens. Here's
nothing.
When it comes to the prostate exam.
Go ahead, Seth.
Hey, the most important thing was his hands on your shoulders.
You see, Seth? See, this is a problem. This is a problem. This is a problem. I'm telling you, I've been assaulted and you're making jokes. This real dog. Hey, Sam, you know what pissed me off, bro? You know what pissed me off is when he got done, he was like, all right, Miss Combs, you can pull your pants up. I pulled my pants up and he pulled that glove off and just threw it in the trash and looked at it. I was like, dog, this dude does not know.
No. The awkwardness is that you still greasy when he gets done. That's especially awful. But
dog, it's shower time. I wanted a cigarette in the shower.
Right. That's why I said they don't buy you
Yeah.
dinner first. It just happens. LV, you have not had your prostate exam yet, right?
Correct.
And we have
Take somebody to hold your hand, dog.
We have a couple of other friends who have not had it yet. And another friend of ours is the reason why I got it done, because Nadine had been hounding me to get this done. And a friend of ours was shocked that I had not had it done yet. And so, LV, you running a little late on that, because isn't it supposed to be checked every 2 years?
Oh, I didn't know you had to keep going back.
Well, I have to
Is
say,
it every
Oh, yeah.
year?
I haven't had it done yet, but the work done and show my numbers are very low. I know I'm supposed to have it actually done.
Yeah, that's why my primary care physician told me I was good, but I just feel I need to get it done.
Y'all are like 2 exams late.
What'd you say?
Y'all are about
That's all I can tell you, dog.
Y'all should have had that twice. They do not use
well, see, I ain't like the average bear. Say this in front of everybody, but I really ain't from here. So my DNA is a little different. So I age, slightly different.
I bet you feel like you got that regular DNA when he hit you.
This is the point that we're actually making on this show. How people will find a reason not to move forward. But
I'm telling you.
But before we go too deep in the woods, what I like to do is bring into the conversation another Wyandotte alum
from the dot,
Mr. Yusuf Harris. We didn't do the good, the bad, and ridiculous. If we have time, we'll do it at the end. But I wanted to give him the proper amount of time so he could share his story and let you know his journey. And I'm gonna turn it over to Seth, because one thing about Seth you learn about the lemonade life. And I thought for sure he'll have something on so we can really celebrate him. But I'm gonna let him tell you about his journey. Go ahead, Seth.
Well, basically, the most recent part of my journey is that I had a kidney transplant in 2018. Call on January 1st. Procedure was done early morning, January 2nd. The kidney transplant was partially successful, not 100% successful. So I'm currently still in stage 4 kidney failure, but I don't have to be on dialysis. So that's kind of where my health stands right now. I have a long history with health issues, and that's just a brief synopsis. So I'm a kidney transplant patient. So I continue to go post-transplant care. Now I see the doctor probably every 3 to 6 months. I see a kidney specialist. I see an endocrinologist. I see a nephrologist. And then I see my primary care physician just whenever something pops up. But those 3 doctors I see on a pretty regular basis.
And it's interesting. Last year, and one or two of them, Seth, I know 3 Black individuals that got a kidney transplant, and I know several people who are on dialysis. And one of the questions I know our audience and listeners want to know: were there signs that you saw it coming, that you look back and said, "Oh, I should have done that differently," or did it hit you all of a sudden, or what happened?
I should have done everything. I should have done everything differently. So I'm gonna touch on a couple of points that the brothers, that LV and Coleman brought up earlier. So I wrote a book, and there's a chapter in that book about health. And one of the main reasons why our parents in the past or grandparents really didn't push us towards healthcare was finances. Nobody wanted a huge bill. Nobody wanted a bill that they couldn't pay. When I got my kidney transplant, health insurance was good. When they finally sent the bill just for the transplant alone, it was $50,000 just for the surgery. That's not including everything else that led up to it. I had to get a fistula placed. I had to get a revision. I mean, all of those bills were in the tens of thousands of dollars. But the actual transplant, they sent me like everything was paid. But when I got the final bill for the transplant itself, it was like 50 grand, man. And for people who don't have health coverage, and I have great health coverage. I went on disability from the Federal Reserve Bank of Kansas City. And before I worked there, people were like, man, they got great benefits. I was like, when I got there, I was like, what benefits? You know, I didn't know what these great benefits were until I went on disability. And then I found out what the great benefits were. When I compare my health plan to other people, even in my household, my wife, my children, my parents, the amount of money they pay for the level of health care that compared to what I have it's ridiculous, man. And so I would see why people would stay away or steer clear as much as possible from getting a bill that they couldn't take care of, that will put them in collections. And then when it comes to fathers, I mean, if you're an active father and you're taking care of your children, the number one rule is you got to provide. And so a lot of times you put those physical ailments to the side because you're pushing with a motivation of taking care of your family, paying the bills, you know, fixing the car, you know, all of that kind of stuff. So you end up putting yourself to the back burner. And I know personally, I've done that. I've taken care of everybody around me and neglected myself for years. And now I'm taking care of myself, but now it's in a sense, it's too late. So I'm doing post care versus preventative care.
You know what? And through this this short time, we've touched on a lot of subjects that we want to just kind of expand a little bit. One is the expense of healthcare being too expensive to get coverage. So I want to circle back on that last because there's things that people need to know what they can do. The other thing was that we talked about, kind of joke, the embarrassment of getting a prostate exam or the embarrassment of getting some things checked out, and that being the reason why, you know what, I don't need to do that right now. I get to it. The other thing we talked about was mentioning is being a provider where you put yourself on the back burner and not knowing that philosophical saying, you cannot pour from an empty vessel. But oftentimes we are providers and we are empty vessels and not allowed to get the proper rest or preventive care that we need so we can be here many years to take care of others. And so I want to talk about that because we have many providers. We have all four of you are providers and fathers. And I want to talk about that, about is that one of the reasons why we kind of put ourselves on the back burner for Black men, is because we feel the responsibility is too great to worry about ourselves because we're worrying so much about others. Coleman, I want to go with you. What is your thoughts on that part?
You know, it's interesting that we say that because the exact opposite is true. Again, you can't provide for someone in the grave. And so if you're not taking care of yourself, if you're not going to be present, how do you then provide? But the question itself, the essence of the question is very true. If I got a dime, you know, 2 cents of it got to go to school lunch, 2 cents got to go to activities, then 2 cents got to go to household bills. You know, I got this 3 to 4 cents left over, and it's like, well, should I go to the doctor or should I take everybody out for dinner and a movie? Well, we're typically looking at the dinner and the movie so everybody can do good. But the question then becomes, will this be our last dinner and a movie? So now you got to start looking at, how do I move this money around? This is the other thing that I learned, and I learned this in banking, which was very interesting to me. The other problem that we have is how to ask. Now, let me expand on that.
Yes,
when I worked in a bank, people would I was a branch manager, and people would cash checks or go out and write checks knowing they didn't have no money. The check would bounce. And then they will come in the bank and demand that we reimburse them the bounce check fees, right? In many cases, they get those demands met. Black people, we be bouncing checks. We'll let that account go into the negative. We'll let them close our account and move on and never ask to get those fees reimbursed. And I say that because when I had my medical issues, the bills were coming in, and I'm like, Sep, I have insurance, and I had $100,000 worth of ICU bills that got paid, but I still had a small portion that was mine. So I call into the hospital one day, and I'm like, yo, I need to start paying on these bills. Just so happened, I called a sister, and she was like, oh, Mr. Coleman, let me put you on a payment arrangement. And then she told me, when I get you to this point, when you just have this amount left, if you call in and can make an arrangement with me where you can pay a portion of it, I will settle your account. I'm like, no shit. She's like, yeah. So next thing I know, I'm making my payments. I get to a point, I had a little bit of, change in my pocket. Called old girl, yo, listen, I need to settle this out. I think I paid a little bit more than a half of my remaining balance, and they closed the account without putting me in arrears or any of that. But we do not know how to ask for help. We do not know how to ask for assistance, and that is one of the biggest pieces. Now, we'll call somebody and go off, but we will not call and be pleasant and have a good conversation about what is owed, what are the rules, and how do we work ourselves through the process. And that has to be a part of our growth as a community, our maturity as a community. Stop thinking that everything is against us. Me and my wife will go out and sometimes she'd be like, you think these people owe you stuff? Because I pull up and be like, yo, you forgot to put my senior citizen discount. They'd be like, you sure right. Be discount my meals and yo, I forgot to order a drink. Yeah, dog. Hey, no, you can ask Sheila.
What's the thing?
AARP, I ain't doing none of that, man. Listen, bruh, I be like, yo, I forgot to order a drink. Oh, I just asked them, hey, you forgot to give me my senior citizen discount. And they'll laugh and they'll give me a discount. I don't know. Shit, if they take 2 cents off, it's 2 cents more that I keep in my pocket. I be going up to the window, man. I be like, yo, I forgot to order a soda. Why don't you give me another drink? They be like, yes, sir. Be giving me sodas and shit. My wife be like, you act like they owe you something. I say, no, I am giving them the opportunity to be nice to me.
Right.
I am going to extend myself to them, and I am going to give them the opportunity to be nice. The worst thing that they can do is say, no, I'm not giving you a free drink. It's a free drink I didn't have anyway. I've not lost a thing. But if you communicate, you give people the opportunity to interact and be nice to you. In many opportunities, in many cases, they will.
Yeah. And that's like you say, if you ask not, you want not. And
Closed mouths don't get fed.
You're right.
Closed mouths do not get fed.
And oftentimes we just simply have to come with a sensible attitude and just ask, because it doesn't hurt to ask. This bill, can you do this? And a lot of companies are set up to give you discounts. LV, I'm gonna swing it over to you and ask about you being a provider. What are your thoughts as far as making sure you being a single father? How do you approach that topic of making sure you're good? I know earlier you said your daughter's, you're all she has, so I know you take that step, but do you let finances kind of dictate how quickly you get there, get checked out? Do you allow the time for you to get there? How do you approach your situation, making sure you're good?
Honestly, John, it depends on what it is and how severe it is. Because, like I said, in the last 5 to 7 years, I really had to take my health a lot more seriously. I've had some serious back issues that had me to I was damn near in a wheelchair. I mean, Brother Coleman can attest. He's seen me at my worst, and I'm far from there now. It just depends on how severe it is. If it's something that I think is really urgent, then I don't give a damn. I'm going to rob Peter to pay Paul, but I'm going. Another thing that really hit home for me, I had an accident a couple of years ago, and it made me like it wasn't a midlife crisis type thing, but it was something that really opened my eyes to my health because I had chopped my toe off and I was stuck outside. I'm bleeding. I see bone chips in the grass and shit. And all I'm thinking is, I'm about to be Kunta Kinte. And the first thing I'm thinking is, how am I going to take care of Lyric? I'm like, what am I going to do? You know, I'm cussing myself for being careless for the accident that I had. And it's just with that happening, I'm just much more aware. And like I said, the least little tweak, if it don't feel right, I might give it a day or two. But like, you know, hey, I need to come in. I need y'all to check this out. You know, because like I said, you know, if something happens to me and I can't provide, then she has nothing. And I'll be damned if I let that happen because I was careless or too stubborn to take care of my. Because I would say my mid-20s through my 30s, I ran through hell with gasoline draws on. Now I'm somewhat like Self. I'm in like post care for some of those things now. You know, that was the main reason why I had the issues with my back, because some of the things that I was doing, you know, I put too much stress on it. I thought I was invincible. You know, I was the Black Hulk. And but really my back couldn't take that, and now I know. So I'm just much more aware. And what I would say to the younger brothers, I mean, because you're young, yeah, you don't feel it now. But a lot of these things, 10, 15 years, they're going to come back. So you still need to get into the doctor early now so you can definitely stay on top of anything that comes up.
And you know, that is so true. And one of the things I have to say, I'm very blessed. I'm overweight, but I haven't had problems with major health issues. And one of the things I'm picking up from everyone here, except I haven't given JP a chance to talk, but it took a moment in time that forced us to correct what we were doing, where we could have done that preventive care. And I'm hoping our listeners and viewers take that information and change the way they're doing it now, so they're not getting to the point where they're forced to make a change because of health related issues. Because one thing for myself, I don't like taking medicine of any kind, and that may be where my downfall is. I will suffer through pain a long time before I take pain relief medicine because I don't want poison in my system. So if I have to
Don't do
take
it, bro.
medicine, I take issue with that. And so with that being said, you know, we there's some levity that we have in some of these things that our community have created, like drinking ginger ale will cure things. Getting up, walking it off will cure things. Put some tussin on it, it will cure things. And some of
Now,
these old
Epsom salt.
folklores, huh?
Epsom salt.
Oh yeah, soak in Epsom salt and get that. And some of these things, there is some truth behind it. Or noodle soup, for some reason, it has a healing factor when it comes to colds and flus and different things. And there's some hidden truth or a little bite size of truth in some of these remedies. But some of these remedies we come out because you know, growing up, I'm sure we all have had a hot toddy or two. And what they would really do is just give a bunch of kids some liquor to make
Gerald
sure.
drinking one right now. Gerald got a hot toddy on his desk.
His wife is every night.
On ice.
He can't go night without a hot toddy.
I like to stay healthy.
Yeah.
But
Yeah.
I'm gonna circle back to Seth because I want to talk about one thing for him because I want to give him an opportunity. But JP, I want you to kind of talk about are you taking preventive care? What are you doing? Because I know used to be the joke that your nephews couldn't outrun you, and you used to train a lot to run. Where are you on that, or has that changed, or what's going on with that?
Yeah, as a younger person, I myself was kind of guilty of the whole invincibility thing. And yeah, I was in pretty good shape. Always was beating the nephews, beating my sons. Like if we ran a 5K, they knew I was crossing that finish line before them. And it did give me a false sense of invincibility. When you beating teenagers, it make you feel like you really doing a lot. And but I can
It
agree
does.
with what Coleman and LV are saying. Uh, I remember one day having a conversation with my son in the car, and I was fussing at him because he did not quickly, immediately put his seatbelt on, and he was holding us up. And his response was, "Well, Dad, you don't have your seatbelt on." I responded to him, "If we end up in an accident, I am more concerned about you ending up okay than me ending up okay." To which he responded, "Well, what about us? Because we want for you to be okay." And it made sense. And so a lot of the healthcare decisions that I make now, it is because of the kids. Even like, I got my little cholesterol pills here on the desk. And before I was a parent, I basically went years without even filling the script. And the doctor had made a comment, this old doctor, and he was like, "Well, you must not care about living. You must be okay with dying." And, I can be a little mouthy at times. My response to him was, "Well, I'll drop dead right in your face right now. Who you trying to scare into taking something?" What, Coleman?
See, always.
What, Coleman?
I just, I mean,
What?
you kind of glossed over that. Said you can be mouthy at times. I just want us to always be honest.
That was being honest.
That was a lie.
That was not a lie.
That was. I mean, shit. That. Woo.
We got company
Okay,
tonight.
as long. I mean, I'm gonna let it go. I'm just saying that shit didn't sound true to me. But okay, anyway, I'm sorry.
Well, when I look at things, what motivates me is being a father and realizing, as you two have said, I can't be a father and take care of my kids if I'm dead. And so I take the meds. I got the prostate exam. We, our viewers don't know this, but as soon as the show wraps up, sometimes I'm like running to the toilet because the
I
results of
I
my
didn't want to say
prostate
it.
yeah. Well, the results of my prostate exam is that I do have a slightly enlarged prostate. My father in law is a prostate cancer survivor. So Nadine is constantly on me to get that prostate exam whenever the hell it's due. I don't even, she tells me, like, it's time for you to get that again because she's afraid, like, listen, we need to be ahead of this in case you basically develop prostate cancer. So between the prostate exams, the cholesterol pills, this, that, we do what we got to do in order to be healthy and alive because kids don't ask to be born. So when you have them, you owe it to them to do any and everything that you have to do in order to be around for them. Something that Coleman said that a lot of people, I want us to touch on that again real quick because I want everybody to know Coleman is absolutely right. It's amazing the medical bills that they will just dismiss if you just ask. A friend of mine has a son who has diabetes, and she told us she gets most of her bills dismissed by simply asking Children's Mercy and saying, what can y'all do to help me?" And so that's something that we need for people in our community to know. You can just say, look, especially if you have a $5,000 deductible or whatever the case may be, which is a lot of money. But yes, do not hesitate to just ask them, "Hey, can I get this reduced? What can you all do?" it would be better to go to the doctor, get the health care that you need, and ask them to cut you some slack on the bill than to not go and end up in a casket.
Yep.
And the
And I ask everybody.
Hey, and the physical therapy is very important, and that is a little expensive. But if you need physical therapy for some type of ailment, it's cheap.
Yes.
At least go 3 or 4 times and learn what they're having you do, so that you can go home and do it yourself. But it's very important. I've had 2 knee surgeries and some back procedures, and without that physical therapy afterwards, and just staying on it myself, because see, that's another part of the healthcare. Like for my back, I have to stretch daily. When I get out of bed in the morning, that I stretch before I go to sleep at night, and I still have issues with my back. But if I didn't do that at all, I probably would be immobilized. So, and once again, and my motivation to go ahead and stretch, even though it hurts, I think about that little 13-year-old girl I got,
Yes,
in
sir.
her eyes, ain't nothing daddy can't do.
Mhm.
That daddy's immortal. There's no chink. When I had to go in the hospital, with the foot issue, that kind of threw her for a loop. It's like, damn, he is human. He bleed.
Yeah, that shit
Because
threw me for a loop.
when she seen my foot, because she helped me care for myself when I finally came home. Like, how that happened? She couldn't believe that something could take my toe off.
Right.
And that was just a toe. But hey,
Yeah.
she know daddy about that life though. I come from this,
Daddy is
And
but
about that life.
but
and I want to
one last thing, John, I just want to impart. Please, young brothers, take go to the doctor, start now. Don't wait and get our age and then start going to the doctor or trying to see about yourself. You don't have to be in the gym 24/7 taking care of yourself, but any type of ailments, go get it checked out. Go get it checked out.
Yes, sir. And one thing I'd like to end with is I want to give the opportunity for Yusef. He was too modest to really talk about it, but I want to give him an opportunity to talk about Lemonade Life and his clothing
Yes.
line and how people can get a part of that because that kind of helped offset some things. So go ahead, Yusef, give us some information on that.
Basically, I do have a website. It's ilive.lemonadelife.com. I also have a Facebook page. It's just Lemonade Life that you can search on Facebook. I had a friend of mine, we call him Scribe, but his name is Donald Ross, that created a logo for me. And I was able to take that and put it on t-shirts and raise funds to kind of offset my health costs. But mostly people gave actual cash donations. And I do that yearly. I try to raise my $1,000 deductible because once I pay the $1,000 deductible, everything else is covered for me medically as far as expenses are concerned. So that's something that helps me since I am on disability to kind of keep my costs down. So I've gone out personally and kind of been an advocate for myself financially to kind of take care and manage my health. And so I live lemonadelife.com and then Lemonade Life on Facebook and also on Instagram. I live Lemonade Life.
Self, why don't you tell them
So,
how you came up with the Lemonade Life?
Basically, the old adage, if life gives you lemons, live lemonade. Make lemonade. And I took it and kind of twisted it because I needed something to motivate me to, number one, I had to lose weight. I had to try to eat healthier. I had to educate myself. And I kind of wanted to circle back to a couple of points that JP and Coleman made, which it sounds like to me, if we surmise what the two biggest issues are finances and education, and then basically pride. And I think they probably follow in that order. To get to the educational part, so as I kind of went on this journey with the kidney kidney transplant and kidney failure, I kind of started to study Dr. Sebi. And one of the things he talks about is that, when JP was talking about going back to slavery, if you even go back before slavery, there's a difference between Eastern medicine and Western medicine. And so I think a lot of the traditions that we brought over from the motherland were that we had natural medicine that could fix any ailments that we had. One of the major points that Dr. Sebi makes is that they took Black people out of Africa, but they didn't bring the food with them. So the food we were eating over there was not giving us high blood pressure, was not giving us diabetes, was not giving us heart failure. But we don't have that diet over here in America. And they've done studies where they've given a person from Africa the diet that we eat in America and then vice versa. And there are drastic changes there. And a lot of the issues that we also have is that we can't trace our history past slavery. So we're not able to go through our bloodline and find out who had hypertension, who had diabetes, am I susceptible to this? I've recently done 23andMe for both me, my wife, and my 2 children. So we have some knowledge, but as we start to research the past, there's such a limitation there because we don't have that information. Looking back as a grown man, I saw people getting their toes cut off. I saw people having heart attacks. I saw people dying, but as a child, I'm not asking myself, okay, what are they dying from? Why grandma can't drink Kool-Aid? Why grandma in a wheelchair? Why her toe cut off? I'm not putting 2 and 2 together, realizing that she had diabetes that was mismanaged. And that is a part of your DNA that can travel down if you don't watch it or take care of it. So now I got to educate my children with habits and eating that can prevent the issues that they might be susceptible to. So education is a big piece of it, and we're at a disadvantage, but it doesn't mean that we can't manage it or reverse it. We have to educate ourselves, and then as brothers, what we're doing here right now, we got to start talking more, man. We don't talk about the sensitive stuff. It's hard for us to be transparent, as we all mentioned earlier. It's about the ego, man. It's about the pride, and a lot of times. Nowadays, it's hard to talk to young brothers, but if you find one, talk to them, because some of them don't have the mind to even listen to what you're saying, but I do have a few that do, and we have to have these conversations with them and kind of convince them that, be preventative about this stuff. Don't be scared to go to the doctor. You got a good job, don't buy 40 this weekend. Put that on your doctor visit. So we do a lot of things, as Coleman talked about with banking. Well, we'll go get a movie and popcorn for the whole family instead of going to see our primary care physician or going to see our endocrinologist or going to see our hypertension specialist. So, I mean, that's kind of where I'm at, and that's the Lemonade Life thing. I can provide more information, but I just thought it was pertinent that we talk about these things, on this platform.
Yeah.
Well,
Hey, John, can I hit on something real quick?
Yes, sir.
And piggyback off Seth. The conversations are the most important piece of this. And I know we try to joke and, we talk about, me going into the doctor feeling like it was 2 fingers or whatever the case may be. The most important part is I was there. We have to have these conversations. And if you feel like the conversation can't be had with the college and high school age brothers, it's very important that we get those younger brothers. And so like the last 3 weeks, I've done this podcast from the football field because my kids were playing flag football. But those conversations about health and things of that nature emanate from sports for me. Because now, anytime something happens with my kids, we're having these conversations about why we go to the doctor, why this needs to be checked, why do we ice? And we have all these conversations. Well, those conversations aren't the big thing. The big thing is that I have a line of communication with my sons that I am trying to keep open, because bad information is the worst information. And we all know the streets will educate our kids if we don't do the job. And even when we're trying to do the job, the streets will still try to impart a level of information that is inaccurate within their lives. So it's important, John, you started this call out talking about putt and some of the things that you were doing with the kids. Well, you can have all the fun that you want with the kids. Now the kids will have dialogue with you, and that dialogue is the thing that's going to carry the day. So now when my kids' friends come over here, I hear one of them do something out of the pocket. Before I can look up and be like, yo, my sons are like, dog, I check that if I was you, because my daddy, he about to come up to them steps. You watch them start being influence on other people. This is the last part I'll make. And when I'm talking about my kids and being a part of the conversation, I'm downstairs, and my wife are downstairs in the kitchen, and my sons are upstairs. Now I don't know how many of you all know Pig Latin, but my parents, when I was young, used to speak Pig Latin in the crib all the time, so that the kids wouldn't know what they was talking about. Well, my parents are deceased now, so my kids, they don't know I know anything about Pig Latin. So I hear my oldest sons tell my youngest son, he said, "Itch Bay, dog." I said, "What did you say?" They're like, "Daddy, we was just playing." I'm like, "Dog, y'all don't know what I know. But I know you better not be in here calling nobody no itch bay again." My wife is like, "What is an itch bay?" I said, "We'll have that conversation later." But if we're not involved in the conversation, we can't start with them teaching them about language. We can't teach them about health, finances, and all these things that we're talking about if we are not a part of the conversation.
Exactly.
And Seth, I got a shirt. Anybody who's thinking about getting a Lemonade Life shirt, good quality shirts, they come to you quickly. I would fully support. I'm going to buy another. I didn't know that they went towards your yearly fees for the insurance. So I'm going to give me another one. But I got one black, the big lemon on it, good quality shirt. So I would strongly support and suggest to people get on that Lemonade Line.
And also get his book, because I got a copy of his book.
Yeah.
On that note, we will definitely get his link and his bio, his information, and put it on our upload, so you'll be able to tap in and get you a shirt or a book, and support this good brother from the dot. And one thing I also want to talk about is, as we close out, is we've talked about getting access to healthcare, and I want people to understand. Sometimes we use the ER as our medical attention, but one thing you should do is learn these three numbers: 311. You can call United Health. You can get connected to some healthcare that could be free or very inexpensive. That's for dental care, that's health care, mental health, all those different things. And also get to know Aunt Bertha, SAUNTBERTHA, is a website that gives you supportive services. So, whatever supportive services you might need, you might be close to homeless, you might be close to needing some food stamps, you might need some type of supportive services. You need to reach out to those links so you can get connected. I want to thank all the brothers for being here. It's been good. We're going to talk more about these things, because our job here is to start the conversation so we can improve our community. And I want to thank everybody for being here. Thank you.
Appreciate you, Seth.
Oh, and one other thing, another black man taking care of his family. I don't know where y'all saying that black men don't take care of their family. That's all I know. I ain't gonna say it's all I know, but that's most of what I know.
Hey, you didn't even rub on yourself today. Stupid. He's stupid, though.
You asked for it?
Wait a minute. Wait a minute. We're still live. We're still live.
Oh.
Just a minute.
We still live?
Yes.
Yeah, you was looking up in the air when you was spelling out birth. I was like, boy, I bet